Good afternoon, everyone. I am Keana Pineda,
And I'm Lana Bui.
and we are the Tea with History podcast.
Today, we're going to be covering legends of public health. For this week's episode, we will be talking about a figure of public health who was the first African American woman to earn an MD degree, Dr. Rebecca Lee Crumpler. So, this is Crumpets with Crumpler. Also, before we get started, how are you doing today, Keana?
I'm actually doing pretty good. The weather's getting a little chilly though, so I've been using like my black puffer jacket. Those are kind of in right now. The one thing that I'm worried about today though is like the gas prices going up. I don't know if everyone in this podcast is listening right now who drives a car around San Jose or commuting to school is worried about the prices because I can just see like Shell and Chevron having $6 per gallon for gas, right, Lana? I don't know if you drive. Do you drive to school?
I do, yeah, but I have an electric car, so I'm not like super worried about gas prices.
Wait, I think that sounds really good. If anything,
I'm environmentally friendly.
wow, I am so proud of you. Imagine having an electric car because I don't have one. And I'm actually considering, using public transportation and taking advantage of that because I cannot afford gas at the
Yeah,
moment.
no, these gas prices are insane.
Wow, okay. But how are you, Lana?
I'm doing pretty good, kind of tired. I mean, we just changed times. I think we lost like an hour of sleep,
Oh yeah, you're
right?
right,
Yeah.
everyone. Oh, that remember that we lost an hour, daylight savings, especially for the spring. So we'll be having golden hour. I'm very excited for that. I don't know about
Oh
you,
my God, I love golden hour.
right? Okay, really good to hear that you're doing well. So yes, everyone, welcome to our podcast.
All right. So Rebecca Lee Crumpler was born in Delaware on February 8th, 1831 to March 9th, 1895. She was raised by her aunt in Pennsylvania, who spent most of her time caring for the sick neighbors, and it's most likely what influenced her career choice later on in the future.
Oh, okay, I see. And I learned that what prompted Crumpler prompted her to become the title of becoming the first Black woman to become a doctor was attending New England Female Medical College in Boston for the Doctorate of Medicine, according to NPR. She came across this opportunity by working as a nurse from 1852 to 1860 in Massachusetts, and was actually recommended in medical school. Despite the faculty's hesitancy, she still graduated within 4 years for an MD.
Period. We love to see it. She also defied prejudice that hindered African Americans from pursuing professions in medicine, becoming the first African American woman to acquire an MD in the United States, a distinction previously attributed to Rebecca Cole. Although little remains to chronicle of narrative of Crumpler's life, her book of medical advice for women and children, published in 1883, has cemented her position in history.
Oh, so she was actually an author and a doctoress.
Yep.
That's crazy.
Imagine. I wish I was that good.
No, yeah, I think she's definitely an icon in that time. Yeah.
For
So,
sure.
yeah, after her first husband died from tuberculosis, her second husband, Arthur Crumpler, was an escaped slave and together moved to Richmond, Virginia to continue her practice as a doctoress.
Damn.
Yeah,
Interesting.
yeah. So during her time, Crumpler grew up in the 1800s. Women, especially African women, were discriminated against in the medical field by men and other people in the medical industry. Such societal issues were racism and sexism that society held against women who wanted to pursue medicine. So overall, schools closed doors to Black students who also wanted to pursue the medical field. Crumpler was one of the women who were faced with such discrimination. However, she continued her passion as a physician to treat children.
Wait, the 1800s, isn't that when like the Civil War ended?
Exactly, the year 1865 was when the Civil War ended, according to the Mayo Clinic.
Oh, sounds interesting. Is there anything else that happened during this time?
Yes, so in 1865, Congress assisted the emancipated Slack in their transition to freedom, distributed food and clothing, offered medical services and medical and educational aid and worked to protect the freedom from seldom and violence. So this was known as the Freedoms Bureau, and Dr. Crumpler herself joined in caring for African Americans who needed people like her for help, according to NPS.org.
Wow, sounds like a hero. Doctor Strange, who? I only know Dr. Crumpler.
Dr. Crumpler,
My
exactly.
queen.
Yes, as a helper to society, the conditions that she worked in are primarily within poor Black neighborhoods, and such neighborhoods don't have access to healthcare and susceptible to illness and diseases. Yeah. So now we'll be covering how Rebecca Lee Crumpler applies to the concepts and how we have learned from this course.
I'm here for it.
Yes. From what we covered from Crumpler's background, she was identified as a Black woman who pursued an MD. She cared primarily for one group who were poor with no access to healthcare, yet the majority of them were African Americans, and discovered that they are the most affected in epidemics such as the smallpox epidemic. Regardless of whether or not they could afford a healthcare, she didn't hesitate to provide them the care that they needed within these communities. According to Dr. Crumpler, she recognized that the most fatal threat to people's health was the lack of shelter, clothing, and nutrition, according to the New England Journal of Medicine. In other words, health inequities were prevalent to those who needed health care the most.
That sounds so nice. I wish I could do stuff like that. What other connections from this course have you discovered?
We also discovered that obvious social determinants that the neighborhoods that Dr. Crumpler contributed and worked with. One is housing, and another is access to healthcare. Based on socioeconomic position, the most adverse or harmful health outcomes for children and adults were observed for the lowest income and lowest educational attainment groups. A survey was collected in 2011 stating that Dr. Crumpler worked alongside patients who didn't have access to healthcare, where their health can be at risk, which can increase the possibility of receiving illnesses or diseases or infant mortality.
Finally, we can make a connection between the levels of racism and Dr. Crumpler's obstacle to becoming a doctress of medicine. Institutionalized racism was one of the major roles not only Crumpler faced, but also other African American females who also wanted to become a doctress of medicine.
So just to wrap this up, we're just gonna talk about how Dr. Lee Crumpler impacted, how public health really changed. So I found that Crumpler began the needed woman representation within the medical field fascinating. Didn't you want to be in the nursing field, Lana?
I did, yeah. What about you?
Yeah, so I discovered that I also wanted to be in nursing my first year in San Jose State. And I believe that without Crumpler, we, along with other women, wouldn't have a choice or a voice, the motivation to help those in your communities. That's why I find learning about women in history very significant today, because we tend to forget how we all get to where we are now. Remembering our history starts with conversations, gives us motives, and remind us that we all have an opportunity to learn about other individuals who made public health possible. If men can do it, we can too, right, Lana?
Period. We don't need men.
Dr. Crumpler and her husband were buried in Hyde Park in Boston to honor her achievements. So being in honor of Rebecca Lee Crumpler is very motivational, and knowing that her history is being recognized is pretty amazing.
It is. I thought her being the first African American woman to earn her degree could be really inspiring for younger girls who also dreamed of like pursuing a career in the medical field. For me, I used her story kind of like as a little reminder that I can also do it, and it's like really motivational for me to just learn about her story and how she got to where she is.
Yeah, I'm very glad that public health gave us an opportunity to, learn about other people. So that, everyone, is the end of our Crumpets with Crumpler podcast. In the next episode, we'll be having Apples with Anthony Eaton, where he talks about overseeing a $10-year billion initiative to improve the health status of low-income Californians. Thank you, everyone.
Bye.